for several weeks, we had many visitors from school districts, superintendents, educators, children, and their main mission was to talk to us about increasing the BSA. But in addition to talking to us about the BSA, Mr. President, they also had conversations about how desperate the need for mental health education is in schools. And I was really impressed with, I think there were 4 students who spoke before the Education Committee, and they were from Sitka, and most of their comments were about the need for mental health education in schools. And they talked about friends who have committed suicide, and I was really touched by their comments. And they came and visited me in my office, and one of the students even offered her testimony from the Education Committee to be part of the documents for this bill, Mr. President. It touched my heart, their comments, Mr. President. Many of us here in the chambers, we're parents and grandparents. We've seen the challenges our youngest go through, especially in their teenage years. As parents, our greatest wish is for our children to feel safe, supported, and able to reach their full potential. But for too many Alaskan youth, this is increasingly, it's not the case. Every day, I think of families suffering in silence with mental health conditions, of the bright young lives lost to suicide or addiction, of potential cut short by stigma because of lack of care. In Alaska, rates of depression, anxiety, addiction, and self-harm continue to climb. Yet stigma and lack of understanding prevent too many of us from seeking help. We need to do more to support the mental well-being of our children. As representatives of the people of Alaska, ensuring the health, safety, and prosperity of future generations is our highest calling. This is not merely a political issue at all. This is personal. It affects our friends, our neighbors, our families. We have an important role to play in reversing these troubling trends. Senate Bill 24 makes mental health education a core part of curriculum by giving students, as well as parents, the knowledge and the skills to look out for their own well-being and that of their peers. It enables them to learn and recognize signs of common conditions, reduce stigma, and know where to turn for help. This type of education empowers young people with life-saving information. It fosters compassion and breaks down barriers, encouraging those in need to reach out without fear of being judged. Our children's well-being is a collective responsibility that requires community-wide solutions. While solutions will not come easily, we know education is one way forward. By teaching our children to understand and care for their mental health, we give them life-saving knowledge and skills. We help break the stigma around conditions like depression and anxiety. We show young people that they are not alone in their struggles. As leaders, we were elected to protect the most vulnerable. Please, please give our youth a fighting chance to live a healthy, happy life. I know that together with empathy and understanding, we can make a difference. I would appreciate everyone's support for Senate Bill 24.